Hello and welcome to another episode of the CIRS Group podcast. I'm JC,
And I'm Barbara.
and today we are talking about lipid replacement. This is one of the foundational steps to the Shoemaker Protocol, and we're going to get all into it. But before we do, just a reminder that this is not medical advice. If you are looking to change anything on your protocol, make sure you clear it with your CIRS provider first.
Yeah, let's talk about fats, guys.
Oh, yeah. So I mentioned that this is a foundational step to the Shoemaker Protocol. Technically, the Protocol starts with step one, which is remove yourself from exposure. But a lot of the providers will recommend that you start lipid replacement before you start the binders, which is step two. And the reason for that is because it helps you tolerate the binders better, especially if you have Lyme or tick-borne as a co-infection. Because the binders pull the biotoxins out of your fat cells, it's literally damaging your cell walls as it pulls it out. So you want to just make sure that you're buffering your fats so that you can repair your cells and the damage that the biotoxins being pulled out is causing.
Yeah, and let's talk for a second about what does it mean to tolerate the binders better. I think that's, there are some side effects that come along with the binders potentially. Most notably, I'll just say is tiredness, different than fatigue. Like you really just want to take a nap. It's a different thing than like maybe even a SIRS symptom of fatigue. And then of course constipation, sometimes nausea or like a lack of appetite or some kind of like you just unsettled stomach, you don't feel that great. But it's pulling toxins out. It's shaking the snow globe. We've used that metaphor before of like throwing the toxins all up and around your body, so to speak. This is a good thing because it's capturing those and eliminating them for you, but that process can still be hard on the body. And so the fats are there to kind of mitigate that and how hard that's going to feel when you're going through the binder step. So if you can get, build up your fats before you start attacking the toxins with the binders, I think that's really crucial. Another thing also is an intensification of your SIRS symptoms, and this is more likely to happen if you are in exposure. So especially if you're going ahead with the Shoemaker protocol, maybe you're in a rental and you can't break your lease, and so you're stuck where you are living and it's not ideal, but your doctor think it's maybe good enough and you both decide together that you want to go ahead and try the binders anyway. The lipid replacement, doing that is going to help that process as well, maybe lessen the intensifications of your SIRS symptoms as you start the binders.
And one good indicator Barbara and I have found in like the amount of lipid replacement we need to do is if we start to experience dry skin issues while we're on the binders. So for me, it happens like between my fingers, like it just gets super dry and flaky, and I'm like, oh, I need to up my fish oils.
Yeah, it's weird how it's the hands for me too. It's like my knuckles get really dry. Like you could see, I mean, they even are a little bit right now, and I am taking lipids. So it's I mean it's winter in Vegas, so I got to do the best I can. But yeah, it's and I have ran out of mine and purposely like held off on doing them to really see if they were making a difference. And they were. They absolutely were. As soon as I got back on them, my skin recovered. It's interesting how it's nice. It's nice to have that like visual and physical proof that the money that you're spending on these supplements is actually doing something.
Another thing that it helps with is lowering your MMP9. So if your MMP9 is high, lipid replacement can help lower it. And specifically in the Shoemaker protocol, the dose recommended for omega-3s is EPA at 2,400 milligrams per day and DHA at 1,800 milligrams per day.
Yeah, and if your MMP9 is higher than normal for, maybe you've been in exposure or something happened, like it spikes for whatever reason, your doctor may suggest upping even beyond that, like going like kind of overdoing the lipid replacement to get that back down. So if your dosage doesn't look like what JC just described, your doctor probably has good reason. So there's some room to play, is I guess my point.
And definitely make sure you're clearing it with your doctor because if you do take too many fish oils, it can thin your blood. So, especially if you have any sort of like bleeding disorders, this is definitely one of the things that you want to talk to your provider about and make sure they're on board with. If you want to up your dose, just make sure they think it's a good thing for you to do based on your symptom set.
Yeah, super important point. So let's talk about like what the heck we're even talking about as far as like what are lipid replacement supplements. I will start with my personal favorite, Omaprem. It's considered an SPM. It's a very high dose fish oil supplement, basically. And SPM stands for Specialized Pro-Resolving Mediators. There's no test, guys. You don't need to memorize that. But they are bioactive lipid compounds derived from omega-3 and omega-6 fatty acids, and they're more concentrated. And so they anecdotally may help you also with pain as well. That's what people usually recommend, practitioners usually recommend them for if you're experiencing a lot of pain. For me, I just notice a bigger difference. Like I did that test where I ran out of Omaprem and I watched my skin get worse despite the fact that I was taking other fish oil supplements. So I specifically tested, is Omaprem worth it? Because it is expensive it's a more expensive lipid replacement, maybe the most. I'm not sure. Don't quote me on that, but it's like $90 a bottle or something like that. So and I take four a day. And so yeah, it can get pricey, but for me at least it seems like it's worth it.
Yeah, so when you were talking about lipid replacement, it's either fish oil or SPMs, or you could do a combination of both. But then there's two other kinds of lipids that your provider might recommend in addition to those. The first one is phosphatidylcholine, which we have talked about before because Barbara really hates the taste.
It's so gross, guys. Well, no, you can get it in capsule form, but I will say the capsules are massive. They're like huge. So if you have any issue with swallowing large supplements, maybe stick with the oil. What is it called? Like it's a like a waxy, thick goop is the liquid form, by the way. I'm really selling this, guys. You guys are all gonna rush out and get P. coli in a second, but it's just gross. I couldn't handle it very well. And it's just a taste thing. My body was fine with it. It was just the eating.
And I thought it tasted like mildly caramely. Like it wasn't delicious, but it was like I could do it. And a pro tip is to put it in your fridge because it is so waxy that it makes it less flavorful
Yeah.
just having it from your fridge. But if you do get the pour out version, it takes forever because it is very thick, very viscous.
Yeah, it was definitely a texture issue for me more than the taste. And then because it's so thick, whatever that taste is kind of hangs out in your mouth. So I'm going to stop talking about it because if it's good for you and it works for you, I do not want to prevent anyone from trying it. I am a big baby about this, apparently. JC did it just fine.
And the reason it might be helpful is it's a phospholipid that plays a crucial role in cell membrane repair and function. So if you are someone who is experiencing a lot of fatigue or tiredness from the binders, this might be super helpful. The supplement is soy derived, but you can also supplement this through eggs. So if you don't have histamine issues with eggs, um, egg yolks specifically is a really great source of it as well.
A newer kid on the block when it comes to lipid replacement are plasmalogens. We've like briefly mentioned plasmalogens here and there in a podcast before, but we haven't done a full episode on that yet. Maybe coming soon. Plasmalogens are what is the company actually
Prodrome.
Prodrome is the company. We'll link all of these actually in the show notes so you guys can check it out for yourselves. But that is a phospholipid found in cell membranes, particularly in the brain, heart, and immune cells. And they are essential for cell membrane structure, function, and protection against oxidative stress. Look at me reading notes.
So there's two that are typically recommended for CIRS patients. The first one is glia. It's more restorative in its function. So it can be great for earlier on in the protocol, especially as, your body is trying to repair from all the damage from the biotoxins. And the second one is called Neuro. It's restorative, but it's also optimizing cellular function. So it's kind of stimulating. And I say that because one, it's going to be better for later in the protocol when your body has a little more bandwidth to use that optimization. And these are expensive, so I just don't want you guys to like spend the money on it if it's not going to be super effective for you at that point in your protocol. But also, just a note, neuro is stimulating, so be careful taking it with stimulants. And I would definitely talk to your provider. The CIRS providers are aware of plasmalogens, by the way. So talk to your provider about it if you think that might be a good option for you. I love both of them. I started taking Glia a few months ago, and I think it really helps with my recovery time from travel. And neuro for me was incredible. It was like it turned my brain on even more than I felt like it was already on. So it's definitely helping with neuroinflammation for me.
Yeah, and just to share my experience, I take Glia, the reparative one, uh, at the moment. I do 4 a day as well, just like the Omaprem. I don't know that I'm noticing a huge difference, but I'm okay with that in the sense that the neuro I did take briefly, but I am on stimulants. First of all, I do consume caffeine and then I'm also on Adderall as a treatment for my ADHD, and the combination was terrible. And not only that though, the dose on the neuro can be very low and still effective. I mean, we're talking like you can take one every couple days. So it is expensive. You're going to go on the website and go, holy crap, that's a lot of money. It'll last you a long time, especially as you start. And I just want to encourage you guys, if you are going to try it, to go very slowly. Again, follow what your doctor says. Your doctor will help you decide what is appropriate for you. But I mean, it is not even a daily supplement. It's a once every couple days, or you could even start once a week. Like go very slowly with it. Again, be mindful of interactions like with stimulants on that. And something else that my doctor specifically talked about with it, which I thought was a really good point, is she recommends only doing the neuro if you are in a good place mentally. And also, to your point, JC, a good place in the protocol as well. Further along, for example, you're feeling good. The reason for this is it does promote neuroplasticity and like just new pathways in your brain to be formed. And so you want those to be formed when you're in a good place. You don't want to be going through some really terrible stress or grief or loss or intense therapy for some, processing something. You would probably want to wait until like those things are figured out and settled and you're feeling really good before you start to incorporate the neuro, because it can kind of reinforce the way you're currently thinking is the thought process behind that. And I don't know that that's clinically proven or researched to any extent, but it's something to keep in mind, I think, when you're considering which one to take.
Yeah, it's a really good point and a good reminder for me as well.
There's your fat stuff, guys. It's they're very important. I mean, gosh, I've been on the protocol, off and on. I've taken breaks. I know we've talked about that, but off and on for what now? Almost 3 years. And I've been on lipid replacement the whole time. That is one thing. Like I said, I took breaks to kind of test things out, but lipid replacement has been a new steady thing in my life. And I mean, it seems to be helping me a lot, and I don't know if and when I will titrate off of them. I mean, I'm not even taking binders anymore at the moment because I don't feel like I'm in exposure, and I've been on them for a while. But the lipid replacement still seems to be really helpful. So it's a steady thing to have in your protocol or in your routine. That's the word.
Yeah, and definitely different people will respond to different lipids differently. So if you are looking for recommendations or to see what worked for other people, a really great resource for that is the CIRS group. You can directly ask, what is your lipid replacement stack, and people will chime in with
Absolutely.
and they will feel strongly about the lipid replacement stack that has worked well for them. It's a great group. So if you are looking for more resources and support, you can join us over at the cirsgroup.com.
We'll see you there.